This is Dental All Stars, where we bring you the best in dentistry on marketing, management, and training. Here's your host, Alex Nottingham.
Welcome to Dental All Stars. The topic of this podcast is the case presentation formula, and we have our guest. It's Eric Vickery, man. He's our president of coaching. He superstar coach, superstar speaker. I can go through his bio. You've heard him a bunch, but he's coached over 300 offices. He's got, almost 70 personally now, and well over 100 combined with all of our coaches. Big fan of helping offices get off insurance. We'll be talking about that soon. And we're on this kick about case acceptance. And this is kind of a 3-part series, if you will. The first was 95.5, finding the why, now case presentation formula. Welcome, Eric. Tell us about this.
Thanks, All-Star Dental Academy. I appreciate you having me on, Alex.
Yes, you're welcome.
You guys are amazing. I love you. So I love that we're putting all this together. I know that it's been, broken apart, separated, but that's important because you can't get to this if you haven't done that. So let's do a quick review. 2 rules in sales, right? There's that S word, sell, that we have to talk about. People don't buy a solution to a problem they don't perceive to have. That's why we reviewed the 95.5 rule. Please go back and listen to that one. Number 2, people buy for their reasons, not your reasons. Typically, buying with emotion, justifying with logic. So go find the podcast we did on finding the why. Now, if we're going to talk about selling, we have to understand something. In dentistry, nobody ever raises their hand and said, I love selling in dentistry. It's like one person in our seminars will raise their hand and say, I love to sell. So we have to first understand, why is that? I think the bottom line is pressure. Nobody likes the pressure sell. Is that fair? It's right. Like, I don't want somebody pressure selling me, and I don't want to feel like I'm pressure selling somebody else. And at the same time, I'll sit in offices and we'll do practice evaluations on site for clients, and I'll hear this phrase over and over and over again. You need a crown. You need 4 quads of scaling and root planing. You need 4 fillings. And that word need is pressure sales. You need to buy this car from me, Alex. And you can translate into questions and still come across as pressure focused. Things like, do you see any good reason why you wouldn't want to go ahead and get this crown scheduled today? How do I answer that? It's to me, it sounds like, do you see a good reason why you wouldn't want to get this car today, Alex? What's it going to take to get you in these leather seats today? And just, I think people cringe when they hear that. Yeah, it just comes across slimy. And so I get why we say we don't like that S word sell. But the sooner we get over the fact that we are in sales, just like any profession is, we're all in sales. Pick a profession, identify something that they have to sell, even a concept. Even a pastor is in sales. He's selling you on a concept. It's just the belief of buying into something. So if we can just put that to rest and say, hey, you know what? I just want my patients to understand what's going on so they buy into a concept. Does that make sense?
Well, sales is like a vehicle, if you will, a mechanism or channel. The question is, do you put good fuel and good information through the channel, or do you use it to manipulate people? So it's a channel. And service and sales are channels to express your passion.
Yes.
And you can do it for good or for dark. So it depends, again, but that goes back to the why we talked about in that. And by the way, I'll put in the show notes links. Don't worry, everybody. We'll give you links to the podcast. You can get it pretty easily. There's a video version or an audio version. We'll make sure you have that, and a transcript.
For both of those previous recordings,
Absolutely,
right?
yes.
Okay, gotcha. So I love that you're talking about sales being a vehicle for light or dark. And you can absolutely use these skills that we teach and turn it into, if you have lack of integrity, you can turn it into manipulation if you so choose. And we ask that you don't do that. Have integrity with this. There's no manipulation. There's no smoke and mirrors. And so when we lay this out for the patient, we remember they buy for their reasons, not your reasons. They don't buy a solution to a problem they don't perceive to have. And so we just go right with that right when we present. So I'm going to give you some synonyms first to use in the formula so that you remember these keywords or coaching hacks so that you know how to start this verbal skill. So People buy for their reasons. Why? And if you remember, the question we ask is, why is that so important to you? So we're going to take that word important and we're going to plug that as the first thing we're going to target. If we remember the word important, we're going to get off on the right foot. So when we use the case presentation formula, step 1, we're going to use why. The word we're going to use is important. Okay. Step 2, we're going to use the 95-5 rule, focusing on the condition. And every time we talk about the condition we see in the patient's mouth, we use the same word. We look in their mouth and we say, you know what? When I see what's going on, Alex, I am concerned. And so throughout the exam and what they've experienced in the exam process and a system we use where the doctor's talking to the assistant and the patient's co-diagnosing with you, they're hearing the word concern. So it's not a surprise at the case presentation formula when they hear this word. They've seen internal photos, they've gone through the process, scan, all of it. So 1, why, we use the word important. 2, conditions, we use the word concerned. Now, in the 95, we talked about not only letting them know what the condition is now, but what's going to happen if they don't do anything about that. And we call that the consequence step. So step 3 is consequences. And the phrase we use there is leads to, because you have this condition, this cavity, that's going to lead to. The beautiful thing about dentistry is we only have 2 consequences that we have to, for the most part, be worried about. Sometimes aesthetics plays a role. We can set that aside for now. But simple, I'll ask hygienists, hey, what's the consequence of gum disease? They'll say bone loss leads to tooth loss. Okay, so tooth loss is one of our consequences we deal with. Okay, number 2, assistance. What is the consequence of decay? And they'll often say root canal. So if you don't do something, that decay hits the nerve, you need a root canal. Well, we're not talking treatment here. We're talking about the condition consequence, and that would be a toothache. So in the consequence stage, we're typically talking about either a toothache or tooth loss. Now, all we want to do in the 95-5 rule in this case presentation formula is say, here's what you said you wanted and why. Here's the conditions and consequences that are going to prevent you from getting that. Test the buy-in. How concerned are you with this? And we're going to check and see with the patient, do you really believe this is a big enough concern to move forward with? Because I believe, Alex, the number one objection is not money, not time, not fear. The number one objection is lack of urgency. This is why you see people say, I can't afford it. And they go get in their brand new Cadillac and they go to Disney World, right, on vacation. So they have the money. They're just choosing to put it somewhere else because they don't believe in the value and the urgency of what you created 15 minutes ago. So we're going to make sure they have urgency and value before we ever talk treatment. So we're in that 95-5 rule. We're still in that 95 world. We're not even talking about the 5% yet. We're going to put this line 95/5. We're going to put this line, this barrier in between the 5s. And we're not going to talk about the 5 until they tell us, yes, they believe they have a problem. And yes, they would like us to tell them about a solution. Dentistry has this inherent problem. And we've talked about this before. You're my patient, Alex, right? And you're my new patient. And I say, Alex, you give me a $200. You give me $200 and we're going to do a new patient exam and x-rays. You pay me and I'm going to tell you your problems, right? Okay. I put that in my pocket. Hey, Alex, if you give me more money, I'm going to fix said problems. You see the conflict of interest, right? And so because of that, we avoid a lot of what's going on in this process psychologically. We say, I don't want to hear no because I don't want to get into that. And admin team can echo this for me. They hear all the time, patient walks out and goes, oh, now the real painful part. They say, oh, doctor must need to put his kid through college. Oh, doctor must have got a new car. Oh, need to send the doctor on vacation. In other words, they're just selling me something. And now I got to pay money for this crown. They'll make these comments. And that is a reflection of that unaddressed inherent problem that we have in dentistry. Not a lot of professions have that. You pay me, I'll diagnose the problem and solution. Even physicians, they'll refer you out for the solution. They'll prescribe you out. Here, we are all encompassing. We diagnose and then we get the benefit of what we diagnose. So in this 95/5, we got to test the buy-in first. Do you believe you have a problem? Would you like us to talk about a solution to it? And how that sounds is we use the word concern. We just say, Alex, how concerned are you with what we discovered today? Now, Alex, if you were to say no to that, yeah, it's not bothering me. And if it ain't broke, don't fix it, right? It wouldn't make sense for me to then say, well, let's talk about those crowns then, right? If you're not in on the problem, there's no solution to even talk about. Another reason why we don't want to do this part psychologically, we avoid this because we want to talk about the solution. We have to give them the solution. Again, that's back to pressure sales. So if I were to put just this first section together before we even get into the 5, Alex, I would say, let's create a scenario. Alex is the patient. So Alex, we did the emotional exam, right? I asked you some questions. I found your why, and I found out that your teeth are important to you because you present a lot. You want to have a confident smile, and you don't want anything interfering with your busy work schedule. Does that sound about right?
Yep.
I got you pegged. Okay, so
You got me.
I got
You
you.
only know me
So,
for 10 years. So
so we find, and let's just make something up. I know you have a healthy mouth, but let's say we find gum disease, it goes undetected, and we find several cavities that you were completely unaware of. Okay. So if I were to lead with this, the word important is always first. I say, Alex, earlier you shared with me it was really important for you to have that confident smile and knowing that nothing was going to really interfere with your ability to continue to work and present and be confident in that process, right?
that's right.
And step 2, I'm concerned. I'm concerned about 2 major issues going on. One is the foundation of your teeth, the gums. We talked about this and how the infection that's spreading underneath the gum line is the number one reason people lose their teeth. I'm concerned about that because you've probably seen people, Alex, have really long teeth and the black spaces in between their teeth. Have you seen that before?
I have.
Okay, that's the advanced stages of what you have right now. That's what it progresses to if you do nothing. If you're
Ooh,
at a, yeah, that's a 8, 9, 10 on the scale, and you're a 4 or 5 right now, 6. We can do something about that now. Okay. And number 2, I'm concerned about the cavities that are going on undetected because you're not feeling anything right now. They haven't hit the nerve of the tooth yet. And you've never had a toothache before, but we talked about it earlier. You've heard of someone who's had to have a root canal, right?
mm-hmm.
And that's why I'm so concerned about these 3 teeth in the upper right that have the active decay, because as soon as that hits the nerve of the tooth, toothache requires a root canal. So, my question for you, Alex, is how concerned are you with the infection in your gums that can cause you to lose your teeth? And how concerned are you with the decay in those 3 teeth in the upper right that can cause a toothache?
Very concerned.
Okay. And that's what we're looking for. Now, if you say not concerned, I did a really poor job on all the systems we teach up to this point.
Or I'm just dense.
Could be low value. You're just here because Heather sent you. My wife
That's
said I had to
right.
come get my teeth cleaned. Okay. So we're looking for 3
She just said
yeses.
the doctor was good looking. So that's why,
Go.
Yeah.
You had to go check it out. So 3 yeses. I just got 1 yes. Very concerned. So I say, how concerned are you with this? Now, key point. I didn't say, Alex, are you concerned with this? I said, Alex, how concerned are you with this? And I want to show the difference between those 2 questions. Obviously, the former is a yes or no question. People lie in 1 word or less. They say, "Yeah. Oh yeah. Yeah, sure. Yeah. Oh yeah, 5,000? Yeah. I'll pay for that. Yeah, sure. Yeah." We call these the yesers. They just yes, yes, yes till they get out and you think in your gut, "I'm never going to see that person again." You know what I'm talking about?
Mm-hmm.
Yeah.
Yes.
We want to
yes.
yes, yes. There's a yes or no question. You got me. So, instead we use the word how. How concerned are you with this? And if you guys heard what Alex said, we haven't practiced this. He just said, I'm very concerned. That's what we're looking for, more than just the yes. That's getting a positive response to question number 1. Now, question number 2, I would ask you then, do you want a solution for that? So I test the buy-in, and then I confirm that we're going to move into the 5%. And this is a very assumptive question. So I just say, so how much sense, Alex, would it make for us to talk about a plan and how we can take care of these things before they become a bigger problem?
It makes sense.
Okay. And again, I didn't get a yes. I got
Right.
a
You're
more
using
words
how.
there
Right.
using the
Versus,
word how. How much sense would it make? And it is an assumptive. Yeah, of course. You're going to get this confirmation from the patient. And now I went from 95/5. I moved that line out of the way, and now I'm diving into the 5. This is a cautionary tale moment. Please avoid the desire to then blurt out the word crown. Alex, I would consider you non-dental. I would consider myself non-dental, even though I've worked in dental offices. I don't work in a dental office right now. But when you hear as a patient, when you hear the word crown, what do you think of immediately?
Ooh, drilling, filling, pain, expensive.
Okay. Money. Survey says number one is money, right? Sounds
Hmm.
expensive. Patient hears the word crown, they hear money. So why do I then immediately say, all right, well, you need 3 crowns on those upper right teeth. You need 4 quads of scaling root planing. It just all went, it just crumbled right in
Yeah,
front of
you're
us,
right.
right? So if we're going to do this great setup, we have to have a really good finish in the 5%. And the best coaching hack I can give you is put the term of the treatment at the end of the definition. So how that goes like this. So Alex, what we're going to do is we're going to clean beneath the gum line on your foundation of your teeth in areas that you can't reach. We're going to get that infection out of there for you. We're going to do that in quadrant in areas of your mouth. So your lower right and your upper right, we'll do that in one visit, and the opposite side on the next visit. Those are 2 hours of our hygienist, Virginia. She's going to take 2 separate 2-hour visits to get all of that taken care of. Now, you're going to hear us use technical terms called periodontal therapy. You're going to hear that, and your insurance is going to call it something. We just want you to know that the point of that is to get the infection out of there and then manage it and make sure it doesn't come back and reinfect those areas. Okay. Does that make sense so far?
Oh, yeah.
Okay. So I define it and then I give the term. I don't say, all right, so we're going to do periodontal therapy for 2 2-hour visits, but that doesn't mean anything to you, right?
True.
Okay. Part 2, those 3 teeth in the upper right, Alex, that we're concerned about. I want you to imagine, let me ask you a question, Alex. Have you ever seen an apple with a hole in the side of it?
Hmm.
Okay,
The
what's
worm.
going on there? A worm. A worm's in there, right?
Hmm.
So that worm is in there doing what?
Eating the apple.
Eating the inside of the apple, eating all the good stuff. Would you buy that apple if you saw that apple?
Only if it was on sale. No, no, I would not.
You're going to pass over that one. So we see your tooth, this cavity, we see this hole on the side of it. We see a fracture, we see an access point, and we see decay. And we see the decay working its way around the inside of that. We have no idea when it's going to hit the core of the apple, the center of the tooth. Once it does that, imagine that worm. If it were to, if let's say that apple was on a tree, it's still on the vine, right? If that worm goes through and eats the core right away, it's going to kill that apple. All that goodness of that apple is going to go away. It's going to cause a problem. Well, same thing with the decay. It's working its way towards the nerve of the tooth. And as soon as it reaches the center, that core, it causes a toothache. It doesn't always send a symptom to you. You don't always feel it right away. It wants to keep that tooth alive so it can keep doing its thing. Okay. So to save that tooth, what we want to do is go in, remove the worm, remove the decay, get rid of it wherever it's worked way it's around in the inside of that tooth. Okay, just like the apple, we're going to get rid of all of that. Then what we're going to do is we're going to put tooth colored filling material in that's actually bonds to your tooth. There's fibers on a filling, and there's fibers like strands or teeth that interlock that we're going to do on the inside of your tooth to bring your tooth together so it's strong.
Hmm.
So nothing can get in between there. Okay.
Ooh, like
Old
a
fillings, they were
fortress.
just, yes, exactly. Yeah, like Lincoln logs. So in the olden days, those were metal fillings and they were just space savers. There was a gap, there was no connection between your tooth and your filling. That's how decay got underneath there. Does that make sense?
It does.
So we're going to do a stronger um, filling inside your tooth that's going to protect it, get rid of all the fractures, all the decay, so that we protect that center, that nerve, that core of the tooth. Okay. Now, so that your tooth doesn't split open, doesn't sever, doesn't break apart, we're going to put a protective coating around the outside, a cover that keeps it, encases it, and seals it so nothing else can get in there and nothing else can break it. Does that make sense?
It does.
You're going to hear us call that a foundation or a build up. And you're going to hear us call that a crown over the top. You've probably heard that terminology before.
Yeah.
Okay. All right.
I feel
So
so much more intelligent now.
so now we're going to take care of the foundation, the gums, and then we're going to take care of those 3 teeth in the upper right so you don't end up with a toothache or risk losing a tooth or having this infection cause you to lose your teeth and of course, invade the confidence that you're looking for. So my question for you, Alex, is, okay, now I'm going to pause right there. So we went 95/5. I've gotten 2 yeses. I've now described the 5 in the vivid terms that we want to use. I use belief windows. I use word pictures to describe what was happening, right? I vividly described it. Now you feel like I understand what's happening It's not just, hey, go up front and see Becky. She'll get you scheduled for that
Well,
crown.
you took me on a journey through my
Hmm.
mouth.
Yeah. Well, and having you understand what you're paying for is a huge part of this process. You, in your mind leaving, my hope is you don't want the worm, the worm to get to the core of that apple. Because
Well,
up front, go ahead.
well, as I'm listening to you, I'm thinking that even if I don't buy that moment, you just invaded my mind in a positive way. Like you educated me. I can now see it, what's going on, and if I go home, I'm just gonna be like, the worm, what's going on? I'm gonna need those linking logs and the protective coating. Like I feel
Hmm.
like going home naked without getting treatment. It was very beautifully done the way you explained it in a way that I could understand.
Yeah. Yeah. The the thing that we hear up front as administrators, managing two practices over 10 different, 5 different years each, 10 years, well, 6 and 4. The thing that I heard the most that frustrated me was after the clinical team left the patient up front with me, they would say things to me like, it's not bothering me. I don't really want to spend $1,500, so I'm going to go ahead and wait.
Mm,
Not knowing what's going on and what's going to happen, the consequence step was completely missed. You have a cavity, go up front, you need a crown. This is what we have to avoid. So remember, I said we're looking for 3 S's. The 95 slash, that slash represents 2. Alex, how concerned are you with saving these teeth and preventing toothache? Right? Oh, I'm very concerned. Okay, how much sense would it make then for us to talk about a plan and how we could take care of that? Yeah, let's talk about it. Boom. I present the 5% to you, the treatment. That's what everybody wants to talk about. At the end of that, now the drum roll, please. Now this is the deciding factor. So once we get to the end of the 95-5 rule, I've now presented the 5%, drum roll, right? And then here's the
mhm.
here's the point. 64% of patients don't get asked if they want to schedule. We talk about this in the great call process. We become answering stations. We become information givers. And then there's this awkward silence. Or we say things like, you have any questions for me? No. All right, you're all set. Go up front, see Becky. She'll get you scheduled. These are the things we have to avoid. That's first acknowledgement. Second is asking the right question. We don't want to say at this point, so Alex, do you see any good reason why you wouldn't want to go ahead and get this periotherapy and these crowns scheduled? It just sounds icky. It's a reverse negative. People don't know how
Right.
to answer that. No. Did I get a
Well,
yes or
one of
not?
the concepts we teach in our programs is that if you basically what you did is you built a ton of rapport, you addressed their needs, and you became the logical choice. It's logical. You don't have to sell really because you've done those three what did you call them?
Yeses.
The three yeses, and it makes sense. You explained
Yes.
to me what was going on. Does it make so the last question, does it make sense to move forward?
So
Is that what
except that's a yes or no. Now we're going to make it an open-ended.
an
So I
open
just take that
question?
same thing and I say for a D personality type or a C, I'll be on the sense side. I'll say, Alex, how much sense does it make to go ahead and move forward with this plan?
Oh, it makes a lot of sense.
Now I'm not just getting a yes, I'm getting more. Now, if it's an
Mm,
IS, I will say, Heather would be my IS, right? I say, Heather, how do you feel about moving forward with this plan?
mm.
I just change that into feel. So
You're
left
using
brain
you're using
analytical.
disc a little
Using
bit.
the disc. Yep, absolutely. So I got to be ready to conform to that because if I ask you a feel question, right, you're going, oh, why are we getting in the feelings, Eric? But as high C personality type, they want it to make sense. How much sense does it make to move forward with this plan? And you can't get just a yes or no in response to that. Now you're really going to get something that has some backing to it, why they're not in it or why they are. You're going to hear things like, well, it's not really bothering me. You need to decide as the presenter, treatment coordinator, or dentist, are you willing to engage in that conversation now and do what you need to do to help this patient make a decision? Or are you going to wave the white flag and give up? Because you're not going to say, all right, well, go up front and see Becky. She'll get you scheduled because that's not what's happening. Our obligation is to diagnose. Our obligation is the patient understand the consequence. They want a solution to that. We're there for them. So I think Shelley did the podcast on permission statement.
Mhm.
That's a direct reflection of this. If we're using the permission statement, this plays a role in that. So let me do this all at once. You can hear the steps. Okay. So, Alex, earlier you shared with me, it was really important for you to have that confident smile, knowing that you had the peace of mind, knowing nothing was going to interfere with your work schedule, that you're going to be confident in your presentations with how things look and feel. And taking that in consideration during the exam, as we reviewed, we had 2 major concerns: the infection in your gums the active infection in your gums, and number two, the active decay in those 3 teeth in the upper right. Now, the reason I'm so concerned about those 2 things is the infection is going to, number one reason people lose their teeth. If you know anybody who lost their teeth, that's probably why. They didn't do something soon enough to stop it. And number two, the decay on those 3 teeth, that's what causes a toothache. And it'll wreak havoc until it's toothache. And that's why you hear people telling you they had to have a root canal done because they didn't do something before the pain happened. So, Alex, how concerned are you with taking care of both of these concerns?
Very concerned.
Okay. Would it make sense then for us to talk about a plan and how we can take care of that?
Yes, it would make sense.
All right, so here's the plan. We're going to take care of the infection underneath the gums first. We're going to get you healthy there. That's called periodontal therapy. Step 2, we're going to take care of the active decay that's burrowing its way towards the nerve of your tooth, and we're going to stop that. We're going to replace it with white material that's bonded to your tooth, and we're going to put a strong protective coating over the top of the tooth to keep it from splitting, and that's called a crown. How do you feel about moving forward with this plan, Alex?
Let's do it.
Okay, now I decide where to go from there. If he says, let's do it, excellent job, I'm ready to go. And then we get into transfer of care, the next step in our process and our system. So I tried to really go through that sequentially so you could hear the steps and clarify. So this is taking the selling out of the cell, but we still got to sell. This is people buy for their reasons, not your reasons. And this is focused on the condition, not the treatment. People want to marinate and hear and understand what they're solving. They don't just want to hear your solution. All right. Sound good?
It sounds great.
All right. Awesome.
The case presentation formula with Eric Vickery, president of coaching at All Star Dental Academy. And in the show notes, I have part 1, the 95-5 rule, part 2, finding the why. I'll even put a link to the permission statement podcast if you'd like to get a little bonus training. And I'm thinking for the future, Eric, we could do a podcast on disc. A disc overview would be nice.
Oh, that'd be great. That'd be a lot of fun. Yeah.
Yeah, we'll do a disc overview. Eric, thanks again for being on the podcast. And for those that are listening, watching, please remember to follow us on Apple Podcasts and Spotify. Click that follow button. And if you're watching us on YouTube, click that subscribe or whatever they call it button. And that gets you the content right away, straight away to your player that you're using. And it helps us in terms of our ranking. It helps us get in front of you quicker. It helps us help all of your dental friends. And until next time, go out there and be an all-star.
We hope you enjoyed this episode of Dental All-Stars. Visit us online at allstardentalacademy.com.